Hello everyone, welcome to the Academy of Online Radiology Education, this month's edition on neuroradiology. I am Dr. Gregory Obala of Oregon Health and Science University. I prepared this with assistance from my junior colleague, my fellow junior editor, Dr. Alpa Duran from Mount Sinai West. I also want to thank Dr. Brownwin Hamilton of Oregon Health and Science University, Dr. Orlando Ortiz of New York University, and Dr. Mohanad Ibrahim of the University of Michigan. These were the senior editors who helped along this way. The first article is on the imaging features of acute encephalopathy in patients with COVID-19, a case series. This is a case series illustrating the varying imaging presentations of acute encephalopathy in 5 patients with COVID-19. The MRI features included lymphoencephalopathy reflected by white matter signal abnormality, diffusion restriction that involved the gray matter and white matter, microhemorrhages, and leptomeningitis. These imaging appearances range between features of infectious encephalitis, post-hypoxic leukoencephalopathy, hemorrhagic leukoencephalitis, and post-viral autoimmune demyelination. Significant respiratory distress is seen in up to 25% of patients with COVID-19, and thus hypoxic leukoencephalopathy contributes to imaging findings of COVID-19, making it difficult to separate primary pathology from secondary complications of hypoxia. The authors note that only one patient had clinically relevant hypoxia, with oxygen saturation of less than 90% on room air at the time of their initial presentation. At this time, encephalopathy is thought to be multifactorial. This next article is on the clinical and neuroimaging correlation in patients with COVID-19. So this was a retrospective study performed at an academic hospital in the United States, examining the frequency of acute intracranial abnormalities seen on CT and MR brain imaging in patients with COVID-19. It also investigated possible associations between neuroimaging findings and clinical parameters such as length of hospital stay, requirement for intubation, death, obesity, and development of acute kidney injury. 641 patients having COVID-19 were seen in the institution over the study period. 150 of these underwent CT and/or MR imaging. Abnormal neuroimaging findings were observed in 26 out of 150, which is 17% of these patients. Hemorrhage was seen in 11, infarction in 13, and leukoencephalopathy in 7 patients. There are significant associations between abnormal neuroimaging and intensive care unit admission, intubation, and acute kidney injury. This suggested that in patients with worsening systemic disease, brain imaging should be considered. This article, MR imaging features of middle cranial fossa encephaloceles and their associations with epilepsy. So in this study, the MR imaging features of middle cranial fossa encephaloceles in seizures and non-seizure groups were characterized with the hope of detecting features predictive of epilepsy. This was a prospective study of 77 patients with middle cranial fossa encephaloceles during an 18-month period at a single institution. 35 of 77, or 45%, had a history of seizures. 20 of 77, which is 26%, had temporal lobe epilepsy, and 42 of 77, 55%, had no history of seizures. Middle cranial fossa encephaloceles features on MRI were characterized by depth, area, number, location, presence of adjacent encephalomalacia, and degree of associated parenchymal morphological distortion. The study did not find statistically significant differences in the conventional MRI features of middle cranial fossa encephaloceles between those patients with a history of seizure and those without a history of seizure. Middle cranial fossa encephaloceles that are large or numerous, those associated with encephalomalacia, and those associated with severe morphologic distortion of adjacent brain parenchyma can be seen with similar frequency between patients with and without history of seizure. Comparison of just those patients with temporal lobe epilepsy, which was 20 patients in this study, and those without seizures, which were 42 patients in this study, also found no significant difference in MR imaging features. Anatomical MRI features of middle cranial fossa encephaloceles may not be useful in predicting the likelihood of elliptogenicity. In this study, variability of T2 relaxation times of healthy lumbar intervertebral disc is more homogeneous within an individual than across healthy individuals. Also recently published in the AJNR October. So in this study, prospectively acquired T2 relaxometry data from 606 intervertebral discs in 101 volunteers without back pain. These were patients of population was made of 47 men, 54 women between 25 and 35 years of age, were evaluated, and intra-subject and inter-subject variation in T2 times of intervertebral disc were degraded by two neuroradiologists on the Fuhrman scale. Intra-subject variation of intervertebral disc was assessed relative to the other healthy intervertebral disc of the same patient. For healthy disc, we consider Fuhrman grade less than, equal to, or less than 2. Multiple intersubject variability measures were calculated using healthy extraneous references ranging from a single randomly selected intervertebral disc to all healthy extraneous intervertebral discs without and with segmental stratification. These variability measures were compared for healthy and degenerated disc. For degenerated disc, we consider Fuhrman grades equal to or greater than 3. The mean T2 values of healthy, which were 493 out of 606 patients, or discs, which is 81.3%, and degenerated intervertebral discs were 121 milliseconds and 91 milliseconds respectively. The mean intra-subject variability for healthy intervertebral disc was 9.8 plus minus 10 milliseconds, lower than inter-subject variability measures, and provided the most pronounced separation for healthy and degenerated intervertebral disc. Among inter-subject variability measures, using all segment matched healthy disc as a reference provided the lowest variability. Normative measures based on T2 times of healthy intervertebral disc from the same individuals are likely to provide the most discriminating means of identifying degenerated intervertebral disc based on T2 relaxometry. Many previous studies have suggested that T2 relaxometry can provide a reliable, objective, and continuous quantitative measure of the health of the lumbar intervertebral disc. Despite these advantages, this technique has failed to replace traditional subjective assessment of the signal intensity of the intervertebral disc on T2 weighted images for the categorization of a given intervertebral disc as healthy or degenerated. The analysis of the same data demonstrated that while the level of stratification might be important when cohorts of intervertebral discs are being compared, T2 times of healthy intervertebral discs at other levels in the same individuals are likely to provide a better measure of the health of a given intervertebral disc than T2 times of a healthy intervertebral disc of other healthy individuals. I've added this slide for the Fuhrman grading system for your own reference, 1 and 2 being what was considered normal, 3, 4, and 5 abnormal. This article titled Tentorial Venous Anatomy Variation in the Healthy Population. This study evaluated the normal variation of tentorial venous anatomy in the healthy population by retrospectively reviewing head CT angiograms and venograms in a total of 238 patients with examinations done for routine care or research purposes. The tentorial network comprises 2 main tentorial sinuses and 3 main veins. The sinuses are the medial and lateral tentorial sinuses, which may be distinct or connected, and when they are connected, it is termed the ringed configuration. The veins are the medial, intermediate, and lateral tentorial veins. This study also evaluated relationships between these variations in tentorial venous anatomy with the extent of skull base development as measured by cranial morphometrics. They found 3 configurations, 1A, 1B, and 2, Group 1A and Group 1B, which had ringed configuration comprising 50 out of 238 patients, and Group 2, which did not have a ringed configuration comprising 188 out of 238. Group 1A, which was 38 out of 50, had a medialized ring configuration, and Group 1B had a lateralized ring configuration, which is 12 out of 50. The ring configuration of Group 1 was related to the presence of split confluence of sinuses, which correlated with a decreased internal auditory canal to petroclival fissure angle. Configuration 1A was positively correlated to the degree of petrous apex pneumatization. Understanding of this anatomy is helpful in preoperative evaluation of complex surgical procedures that involve tentorial incisions. And this article detailed arterial anatomy and its anastomosis of the sphenoid ridge and olfactory groove meningiomas with special references to the recurrent branches of the ophthalmic artery. This study included 20 patients admitted to the Department of Neurological Surgery at Okayama University between April 2015 and March 2020. There were a total of 16 sphenoid ridge meningiomas and 4 olfactory groove meningiomas identified and evaluated. Preoperative DSA was performed with the patient under local anesthesia. After updating 2D DSA of the external carotid artery and internal carotid artery, which are ipsilateral to the tumor, 3D DSA with the 5-second protocol was performed on the branching feeders of the vessels. Collateral anatomy was also analyzed by 3D rotational angiography and slab maximum intensity projection images of these lesions. 19 or 95% of the lesions had feeders from the ophthalmic artery, 15 or 75% had feeders from the internal carotid artery, and 15 or 75% had feeders from the external carotid artery. Feeders from the ophthalmic artery, recurrent meningeal arteries were involved in 18 lesions, up to 90% of them, and 75% had anastomosis between each feeder. Detailed arterial anatomy of the sphenoid ridge and olfactory groove meningiomas is complicated due to the fine angioarchitecture and anastomosis between each feeder. A detailed understanding of arterial microanatomy is useful in surgery. If we identify all of the feeders using preoperative angiography, we can search for feeders on the basis of the anatomical landmarks of the bone and devascularize them in a safe and efficient manner. Thank you. That will be all for this month's Academy of Online Radiology Education review of articles.